The first baby with a Zika-linked birth defect has now been born in the United States. Health officials at New Jersey's Hackensack University Medical Center say that a 31-year-old woman from Honduras contracted the virus abroad. The woman was in fact visiting the United States when she gave birth. Her baby girl has microcephaly, which can cause unusually small heads and brain damage of varying degrees. Nearly 600 now travel-related Zika cases have been confirmed in the United States thus far. To discuss it all, CBS medical contributor Dr. Narula is here.
Hi,
and
Josh.
So, hi, Doc. There's a lot to get to here, but specifically for the staff here at this New Jersey hospital, is Zika a blood-borne virus that should give pause to the fact that this baby was born in a facility? Is there a concern there?
There's certainly precautions that the hospital staff are going to need to take, and the CDC has recommendations about that. But more importantly now is going to be managing this baby and following this baby going forward. You know, microcephaly unfortunately is irreversible, is associated with developmental delays or seizures, vision and hearing problems. So the baby will need to be followed by pediatric neurologists, infectious disease specialists, and potentially speech and physical therapists. And screened going forward for hearing and vision issues.
We've had guests join us previously, including a woman who contracted the disease while traveling abroad. She came back and said that upon being diagnosed, that her doctor recommended, if she was looking to become pregnant, that she wait 3 years, whereas the CDC itself said you can wait 8 weeks.
Right.
Not to beat a dead horse, but really to start banging a drum here. That range, if nothing else, certainly gives pause, does it not, about what we don't know?
It's a big spread, 8 weeks to 3 years, yes, and we don't know a lot, and the science is going to keep changing. And I think the best thing for people is to follow what the CDC is saying now. I mean, they have the most up-to-date research and science. So, you know, the CDC website is chock full of information for people, but I'm sure that there are going to be differing recommendations from doctor to doctor. There's a lot of fear around this disease, particularly, you know, if you're pregnant and you want to do everything you can to avoid this potential complication. But yes, I think there's a lot that we don't know.
We also have heard that if a male contracts the disease, that it's you know, that men should wait 6 months before looking to conceive. But again, that is quite a window, considering how long mosquito season, if you will, lasts in this country. I mean, you're suddenly talking about just a matter of a few months, really, where people who live in areas with mosquito infestations can safely, comfortably conceive.
Yes, I think it's going to get a lot scarier in this coming summer months. You know, we haven't seen any locally transmitted cases so far, but it's only a matter of time. And once that happens here, I think the level of fear is going to go through the roof.
The Obama administration asked for some $2 billion, just under, in emergency funding. It was cut by a few $100,000 in the Senate, and now the House is offering up $600 million in change. Obviously a far cry from the initial ask. What has to happen to get real funding now to start answering all these unanswered questions? Because if nothing else, I would assume that the optics here, right, and the fear that they engender, it's going to have a profound effect, as you mentioned, as we see these first cases develop.
Yeah, I mean, Dr. Frieden, the head of the CDC, said it really well recently when he said it's like standing there watching somebody drown and knowing how to save them but not being able to save them. And that's what it feels like, you know. So I think we desperately need the funding. Everybody in the science and research community is saying the same thing. So it's just, you know, this needs to happen quickly. So whatever compromise needs to happen to get the House and the Senate on the same page needs to happen fast, because as we said, the summer months are approaching.
A colleague of yours and a fellow CBS medical contributor, Dr. David Agus, said on CBS this morning, earlier this week, this is a looming public health nightmare. As I get you out of here, you know, the world is going to be descending on Rio in a few months for the Olympics. The World Health Organization has now come out and said, move those games, delay those games, adding its voice to a chorus now. What do you think?
I think that's a very reasonable thing that the World Health Organization is saying. You know, that having all of these people descend to Brazil and potentially then transmit the disease, the virus, elsewhere, this is something that we all need to take seriously. And there's no reason why, if the World Health Organization is saying to move it or delay it, that we shouldn't be listening.
Dr. Narula, terrifying stuff, but we do appreciate your insights.
Thank you.